So at the moment, we are running virtual wards in NUH. So I'm just going to go through where we are, what we've done, how we've got where we've gotten. And unfortunately, Mark was on nights last night, so I do ignore his name at the bottom there. He won't be able to join us this morning. So what is a virtual ward? At the moment, they're also known as hospital at home, and they allow patients to get safe level patient care at home in familiar surroundings. We've known it for quite some time as enhanced recovery in our trust. We've been very, very good at doing what we do. And unfortunately, that's gone a little bit under the radar for quite some time. So part of the work that we're doing within virtual wards is to look at what we've done previously, be able to lift and shift that and report those numbers nationally through Foundry into NHS England's databases. So a bit of history around where we are. It was originally piloted in 2007. They've used different formats, and virtual wards are, believe it or not, a thing across the entire world. Today we've got things like AMRA, SU and OPAT. They are forms of virtual wards that are already in place in NUH and have been for quite some time, along with the orthopaedic trauma rolling lists. Do apologise, there's a freight train going past that side, along with the orthopaedic trauma rolling lists and other areas that we see in NUH. It was about September, October 21 that NHSE said that they wanted to look at starting virtual wards. They're pre-COVID, if anybody can remember those times, and they were looking at respiratory, cardiology and end of life. January 2022 pushed things a little bit further as COVID came in, and they looked to implement respiratory virtual wards for COVID. And we also saw quite a few maternity virtual wards come up as well. NUH had one of the largest virtual wards in the country with maternity patients that resided in it at that point in time. We've seen mixed results. It's worked in some areas, it hasn't in some, but from an NUH perspective, we started to work with the Willing. The national directive sat around respiratory and frailty. Obviously, as people will remember, that was a very difficult time within our trust for colleagues. So surgery straight away said that they had a real ambition to look at what they were doing and how they were doing it, to see what they could do to be able to pull those through. And we've worked with them for quite some time now. This is being run by the system. So as you can see, we've got all of our teams around the system looking at what we're doing. Our funding came down from NHS England, and NUH got about £2 million, £2.5 million of that funding this year that we've been using to be able to support the virtual wards within the organisation. The targets are 40 to 50 beds per 100,000 of the population. So for us, as one of the biggest providers in the hospital in the region, we're working alongside Sherwood Forest, Notts City Care and Notts Healthcare, and also Doncaster and Bassetlaw as providers. We are one of the biggest, so it is expected that we will be able to pull through quite a few of those numbers if we possibly can. These numbers, this virtual ward, the Access and Nerve Centre is a little old. We've got 114 patients on today, most of those residing in respiratory and surgery. With gynae were very much a lift and shift virtual ward. Our gynecology teams were doing an awful lot of work supporting patients in the community that was never acknowledged, which meant we've discovered that for a lot of that work, they weren't actually being paid to do it. So there's a great deal of consultant and specialist nurse time that wasn't being paid for. So we've managed to pull back some funding within those areas to be able to support what they're doing and keep patients at home as well. Our NUH occupancy, we've just updated that. So the number of the patients on the virtual ward by month has just hit over 1,000 patients. A majority of that is lift and shift, but we have seen quite a few beds saved by this, which we'll go into in a second. And those figures, I'm afraid, unfortunately, are only up to November. With quite a lot of our lift and shift work, those bed day savings are historic, and we wouldn't be able to account those and where we're coming through. But when we're looking at the length of time that the patient's on the virtual ward and how many days they've stayed on the ward, which would have equated to a bed day within the hospital. Within surgery, that's equated to 746 days per month, bed days per month last year, which I think I'd have to have a look. We'll divide that by 30. That'll give you the number of beds you'd have to say. We've got an entire ward of patients that are at home that we're working with. The medicine and surgical bed days are the only true bed days that we can really account for as we're pushing through to NHS England. And just to be clear, we've fought really hard to make sure that these aren't beds that are going to be removed from the trust. We already don't have enough for what we're going to do. This is helping the enhanced recovery programme, and it's trying to support some extra flow and capacity through the organisation. There's a great deal of governance that sits within the virtual wards as well. Each speciality, as they come on board, work through an SOP. We work with three providers, should I say. In community, we've got Notts Healthcare and Notts City Care. And we've also got a team called Ciensis, that are a third-party provider that work with us purely in surgery. They have their own SOPs and guidance that sit within their organisations, and we pull those through into ours. And as an organisation, we also have SOPs that go through the internal specialties governance to make sure that we are staying safe and we are keeping those patients going through in a safe way. We work with the teams and with the consultants to make sure that the right patients are going out, and patients that they are comfortable with are going out, because ultimately the consultants are responsible for these patients at home. That governance goes up through the ICS into the UEC Urgent and Emergency Care Delivery Board, and we've been working with them for quite some time to feed back our development, how well we're doing, and feeding into the national statistics and where we're sitting. Like everything, it's all got its own risks and issues that sit within it. The funding for virtual wards that's come through is year on year. We don't have recurrent funding as yet, and with the Trust's financial position, that's made that incredibly difficult. This virtual wards has sat within winter planning. We have been able to capture what we're doing and how we're moving it, and it has helped support some flowing capacity through the organisation. The engagement with community providers is difficult. They have limited availability to be able to support patients that go out, particularly our surgical patients as they are coming through, which brings us on to where this will probably sit within anaesthesia and where you'll see some changes. So one of the next steps that we're looking at going to be supporting trauma orthopaedic patients with frames after acute fractures, managing pin site infections, and making sure that what we're not doing is waving those patients out the door as they go. We know within the community there is at least a 6-week wait for physiotherapy and services patients to be able to access those. We have a virtual team that have a team of physiotherapists within those that would be able to get to the patients straight away. Children's phototherapy and palliative care, you won't see as much of, but you know they'll be happening in the background. And the respiratory homeless, we know that we have a group of patients that come into the organisation in crisis in winter. We're supporting those at the moment in the community to try and give them access to antibiotics and chest x-rays and bloods early to be able to treat infections outside of the hospital before they get to the point where they're in crisis. Steve, I'm just going to share Nerve Centre if you wanted to stop recording.